Dr. Alyssa Quimby. I'm so happy that you're here with me.
Well, thank you so much for having me, Abby. I'm really excited.
I mean, we sort of talked about what are we going to talk about, but as I'm sitting here, all these other things are coming to mind.
Oh, I can't wait.
Okay, well, why don't we talk about how you ended up in your field of health?
Absolutely. So I am a full-time OB-GYN at Cedars-Sinai. I have a very busy clinical practice, and I started actually thinking that I wanted to become an OB-GYN when I was in 9th grade.
Whoa.
So very, very young in the journey. I've been around women's health my entire life. So my mom is a nurse midwife. So
Amazing.
I, grew up around babies and her, having to leave for deliveries and all of that. In fact, I remember as a little girl, would be at the grocery store or something, and a woman would come up to us and say, "Your mom delivered my baby."
So awesome.
So
yeah.
just seeing the joy that her job brought her, of course, that had an influence on me.
Mm-hmm.
And interestingly, I'm actually the 3rd generation in my family to deliver babies.
Wow.
So it is kind of my family business, which is pretty cool.
What was the 3rd generation up?
Yeah, so my great-grandmother was a lay midwife in Wisconsin, and then my mom was a nurse midwife, so she had her nursing degree and then got her master's in midwifery, and now I am an OB-GYN.
Oh my gosh, I love that.
I know, isn't that fun?
Yes.
It's very cool. It's very, it's wonderful to get to this job. Of course, I really do love it, but there's something that's really neat about it, feeling like it's in my blood.
It feels very like the natural organic path.
Absolutely.
So in 9th grade, what happened where you were like, this is the path I'm going to take?
Yeah, so interesting. We had to do a project to, look into different careers. And at the time I thought, I want to be a veterinarian. That sounds really interesting. So I did a bunch of research on, how that works and getting into vet school, etc. And what I found out was it's really hard to get into vet school. It's actually a lot harder to get into vet school than medical school.
Whoa.
I know, isn't that interesting?
Yeah.
And vets don't actually make that much money most of the time.
Yeah.
And so I said, well, that's interesting. Well, I don't know if I want to do that then. Yeah. And then, of course, the influence of my mom, I'm like, maybe I want to be a doctor. And my parents, of course, were very supportive. But as I'm sure most parents would think in 9th grade, like, we'll see, what really sticks and, what's all going to happen. Mm-hmm. And it really was, my dream and sort of mission in life. And year after year, that was, still what I wanted to do, still what I wanted to do, still what I wanted to do. And then, through college and here I am today.
Did you know OB-GYN?
Great question. No.
Okay.
I thought, of course, we'll see.
Yeah.
That's always been part of my life, and it's something that, feels natural and comfortable to me. But in medical school, you rotate through all of the different specialties. And when I got to my OB-GYN rotation, I really did fall in love with it.
Amazing. Where'd you go to medical school?
University of Vermont.
Oh, where'd you go to undergrad?
I went to undergrad UC Santa Barbara.
Okay.
Yeah. So mostly raised in Southern California. Mm-hmm. And when I went to medical school, my mom was like, did you have to pick the farthest away medical school?
Of course.
But it was really wonderful. Being in New England it was a great experience.
Oh, it's amazing.
Yeah.
Did you get placed right away at Cedars? Like, how long have you been there?
Oh, great question. No, so I've been at Cedars for about the last 6 years.
Okay.
Prior to that, so I was in medical school in Vermont and then came back to Los Angeles for residency. So I did my residency at USC, which was a really excellent, robust program at the county hospital, really good training. And then I stayed on as faculty. So I was in the faculty practice there. I taught medical students. I led the medical student clerkship. So I was doing a lot of education, which I really loved. And then about 6 years ago, Cedars was going to be opening a practice on the east side of town in Los Feliz, which is where I live. And so one of my partners, who's still my partner at the time, we were like, let's do it. Let's jump ship. And so we moved over to Cedars and haven't looked back. It's been, a really amazing
And you
experience.
practice in Los Feliz.
I sure do.
That's awesome. I didn't realize that.
Yeah. So I am a rare bird. I actually get to walk to work.
That is
who in Los
beyond
Angeles
rare.
does that?
Nobody.
I know. It's wild.
Yeah.
It really is. It's pretty wonderful.
So, and at what point, so let's talk, you're a mom.
Yep.
You have 2 kids.
I do. I've got 2 little girls.
I want to know, I've heard from multiple OB-GYNs that their birthing experience was not ideal because everyone assumed like, well, you got it. You know what you're doing.
Right.
And I've heard really horrible stories actually about it. Not all horrible.
Yeah.
How was your birthing experience?
Oh, that is an interesting question. So, I was not expecting to talk about this,
Sorry,
but let's go for it.
Can't
No,
help
I'm
it.
into it. So in terms of my birthing experience, at the time I was working for USC, I had Kaiser insurance, so I delivered at Kaiser, which, nothing bad about Kaiser. I think it can be a really great health system. The thing that I think is challenging, especially for a lot of women going through pregnancy there, is you feel a little bit like a number, right? Because you maybe have one doctor that you're seeing during the practice, but then you have no idea who's going to deliver you. And I was really fortunate because one of my good friends was an OB-GYN at Kaiser. And so I saw her for my prenatal care, and she, came in to deliver my baby. So,
amazing.
Very unlike the typical Kaiser experience where I really almost got like a private practice experience, even though I was in the Kaiser system. And, she wasn't there the entire time. She wasn't on call when I came in. And so there were definitely some time periods where there were some, dips in my first daughter's heart rate. They were concerned that they were going to have to, do some interventions, have to potentially do a C-section. And it was really weird, honestly, to kind of, I don't know, toe the line of I'm going to be a patient, but also I have all this medical knowledge surrounding this thing that is happening to me, right? And so there were points where the doctor who was on call came in and she goes, I really think we're going to need to do a C-section. And my husband's looking at me like, oh God, what? And I said, well, actually I think that there's moderate variability, some things about the heart tracing that I felt comfortable with us continuing, which was against the recommendation of the doctor at the time. So that was a little bit of a sticky situation. Yeah. And after this woman left, my husband was like, what's going on? Yeah, what do we do? Yeah. I'm like, babe, it's okay. We got this. Yeah. But in the end, it worked out and it was fine, but it was, there were some moments of challenge, I think, in that. Yeah.
I think it's hard for any of us to relinquish control. When you're so knowledgeable about something, it's really hard.
Absolutely.
Yeah. Absolutely. And how was your postpartum experience?
Oh my gosh. Postpartum was quite the education. Quite the education. I really struggled postpartum a lot.
Both times?
No. Second time was amazing. Okay. First time was just really, really challenging. And in a way that I think has been so beneficial to my practice and in the way that I counsel patients, now about postpartum and just the empathy that you have for people, and I think that for all OB-GYNs, going through the experience of being pregnant yourself and giving birth, I think that really does change how you practice, but especially for me in the postpartum period.
Yeah. What resources, again, we did not pre-discuss that we were going to talk about this, but okay. What resources do you like to give to people? I really have this question both for infertility and for postpartum, because I always say I wish more started at the OB-GYN's office.
Yes, absolutely.
Which is not a diss on you in any way. Right. It's just like not standard practice all the time. Right. Hoping it's becoming more standard practice. Right. Where do you reach out for support on things like infertility, postpartum help?
Yeah, that's a great question. So in terms of infertility, usually the conversation of infertility will start in my office, of course. And I've got some great REIs in the community that I like to refer to. I know you and I were talking about that previously, where especially infertility, it is so ripe with people being able to be taken advantage of because it is a mostly cash business. Right. Most things are not covered by insurance. And so many women, when they get to that place of going to an REI, are desperate, you know? And so I think that really going to somebody that is recommended by your physician, that they've had this personal relationship with, they know that they're not out there for the money and taking advantage of patients, that really does make a big difference for people. Yeah. So I guess that's the fertility piece. In terms of the postpartum piece, I would say, for us at Cedars-Sinai, we are very lucky. We have a reproductive psychology program that's part of Cedars. And, I've worked in multiple hospital systems and have never seen anything quite like this. So it's run by a social worker. We have a clinical psychologist that's part of it. They do group therapy sessions. They connect people with resources. Amazing. And so I feel like that has been a really, really wonderful, resource for people and wealth of knowledge. Of course, it's one group, it's difficult for them to serve everybody and, give everyone the resources that they need. But I think it's a really good starting place. And then the other thing that I encourage people to do in the postpartum when they're struggling is, getting connected to a mom's group. Pump Station is a really great resource here in LA that has, I call it like the breastfeeding mecca. Yes. So when people are struggling with breastfeeding, that's a resource that I send them to.
I think speaking of like overwhelm of patients and that you can't serve everyone, are you still delivering babies?
I am.
Do most people in your practice? You do?
I do. Yeah. So my group, it's a 7-female group, which I really love.
Yeah.
We do it's a shared called model. So meaning that one of us is generally on call each day. So it's about a 24-hour period of call. And so, the downside is I don't get to deliver all of my own patients. The upside is I have 2 young children, and, having a balanced life and not being on call 24/7 is really important.
Yeah.
And, we're really upfront with our patients and explain kind of the model. And also I tell people, this is sort of my spiel, is like, I have handpicked these women to work with because we have similar practice styles. They're excellent physicians. They've got great bedside manner. And it just gives me confidence knowing that even if I don't get to be there for you during your delivery, I'm still going to, of course, support you your whole pregnancy, that I know you're going to have a good experience. And, I think people appreciate that.
That's so helpful.
Absolutely.
Okay, so to switch gears a little bit,
yes,
we were going to start talking about libido.
Yes,
dun, dun, dun.
I know, yay.
Really at all phases of women's cycles.
Yep.
But why don't we start with general libido and then maybe starting with like fertility?
Yeah.
And when you're trying to get pregnant and when you're struggling to get pregnant and how those might change.
Yep, totally. And I did not mention this from the beginning, but in addition to being a, full-time OB-GYN, I have started an online presence, I guess you could say, or an online community resource, called Female Health Education. I started this with Dr. Sarah Toogood, who's one of my partners, who's wonderful and amazing. And it's really just a resource for women to have more information about sexual health and feel empowered regarding sexual wellness, because it is something that as OB-GYNs we see in the office all the time. And I think that for a lot of us, people sometimes feel ill-equipped to be able to help women when they come in and, they're here for their annual exam. And then at the end they say, oh, also I'm having low libido, right? And
why do we always throw it in at the end?
Because people are nervous about talking about it, right?
Yeah, but it's like they know they shouldn't walk out the door until because that's their time. 100%. But they sort of just throw it out at the end. Like it's not that important, but it is.
But it is. It's hugely important. So, after many, many years of being in this practice and just having more and more women that were realizing like this is a real struggle, and like many, many women are coming to us with libido issues, we wanted to have more of a resource for them. So Female Health Education was born, which is pretty wonderful.
Amazing. What dictates our libido and why does it change with age?
Yes, great question. So, libido is, especially for women, it's extremely complicated, which is part of the reason why when women come to our office and they want an easy fix, there isn't an easy fix, right? Like people come in and they say, just give me testosterone, it'll fix it. Or give me, some of those new medications, Vyleesi, Addy, things like that, that'll fix it.
Right.
And while I wish that was the case, it's not, right?
Yeah.
Because especially for female libido, it's physical, it's hormonal, it's emotional. There's so much that's going in our heads surrounding our libido that it really is more complicated. So to get to your question, when we think about female libido, especially when we're thinking about like male versus female differences, for most women, as I said, it really is an emotional process. So it's what's going on with all the other things in your life that are then making it so that your libido is in a range that you want or in a range that you don't want, right? So like, what's your stress level? How connected are you to your partner at the time? What's going on with your children? Do you have a messy house? Are you sleeping well, right? Like all of these factors that go into it versus, if you compare men, for example, they can have like the world can be falling apart and they see you naked and they're like, let's do it. Right?
Totally.
It's so different.
Yes.
It really is.
Why is that? Like 1,000%, there's times where, God love my husband for sharing all of this. He knows I'm an open book and he's like, great. My house will be a mess. And it's like, I have the choice of going to bed with my husband or cleaning the house, and I'll choose to clean the house 100%. Because I cannot focus. It's like a stressor for me.
Absolutely.
Right? Like, why is that?
Yeah. Well, and I mean, I think it's honestly just the difference of male versus female brain chemistry, like really, truly, you know? And like I said, there's other factors too. Hormonal factors, of course, play a role, which is why, you know, we see a lot more women at least coming to us with low libido as they're entering more of the perimenopause stage, that can be part of it. But also anytime there's a big transition in our lives, right? So in the postpartum period, I had patients come on all the time saying like, I feel like I'm healed, but I have no desire to have sex
You're like, is
anymore.
it ever going to come back?
Exactly. Yeah. Is it ever going to come back? Or, you know, what you were alluding to earlier with the fertility piece, right? Like when I'm counseling patients, especially regarding trying to get pregnant and what we're doing and the cycle tracking and all the things, you know, I really do almost always try to bring up that for many people in this time period, sex starts to become like a job, and then it's not fun anymore, right? And like, what are things that we can do to add to that to make it so that it doesn't always feel like sex is a job and that it's not just a means to an end. Right.
It's also like on demand. I need you to perform right now. 100%. That gets really hard on the guy usually.
Yeah, on the partner. Totally.
At what point, so let's talk about some of these meds that you talked about.
Yep.
What do they claim to do? And I know they do work for some people.
Yep.
What are the factors that will figure out whether they work for you or not work for you?
Oh, yeah. Good question. I guess I would say I think that they are a good addition. So there is Addie, which is the like female Viagra. So if you've seen ads for that, it's like this little pink pill.
I hear it on lots of podcasts.
I bet you do. Yes.
Not ours yet, but I do hear it on lots of podcasts.
Yep. So that one you do have to take daily. Or there's another one that has come out recently, Vyleesi or Vyleesi, and it's an injectable. And that one you inject like, you know, the day that you were thinking that you're going to have sex. And, you know, they're essentially what they're doing is helping with what's going on in our brain chemistry. That is the goal, of course, is to boost our libido and make us more interested in sex.
Okay.
I've had, you know, and there's actual scientific studies on all these things, right? And, you know, there's kind of mixed results. I will say in my patients that I've tried it in, I've also got mixed results. And it doesn't mean that, you know, for those of you listening, it doesn't mean that it's not something that you can try, but the thing that I would encourage you in is there's no easy fix here, and that you really do have to like look at all of these other factors in your life, and, you know, to help work on all of them at the same time and not just let's just slap a Band-Aid on it or whatever.
What about testosterone? What does that do for women?
Yeah, so testosterone is there's a lot right now. I'm sure you've heard a lot of podcasts about this as well. There's lots of talk and buzz about testosterone, which I think is cool. You know, I think that that's really wonderful that women are becoming more educated on this and we're thinking about other hormones beyond just estrogen and progesterone. So the theory behind testosterone is, as we age and as we, you know, move into more of this perimenopausal period, our estrogen is decreasing, our progesterone is decreasing, but also our testosterone is decreasing. And testosterone, even though we think of it as a typical male hormone, it really is, you know, women have testosterone too. Exactly. And so with testosterone, you know, what they found is in certain populations that we're supplementing it with, they have more energy, they have more sex drive. So I've definitely seen it work in my patients without question. But it's also not a blanket of like everybody who goes on testosterone is going to feel better. Right.
Yeah.
And it for the most part really should be reserved for people who have low testosterone and are in this time period of their lives of, you know, their hormones are changing. Exactly. So like, would I give testosterone to a 25-year-old? Absolutely not. Does that make sense?
Yeah. How do you feel about GLP-1s?
Well, so I guess
kind of under your umbrella, kind of not under your umbrella.
Yeah,
both.
Exactly. I mean, I get asked about it for sure. In terms of GLP-1s, I mean, I think that the jury's a little bit out in terms of like what's the long-term data going to look like on it, right? And I think that in my mind is the thing that I worry about, because so many people have gotten onto this GLP-1 bandwagon. And don't get me wrong, I mean, I've seen plenty of patients who have amazing success with it. The way that I guess I would think about it specifically in terms of libido, for many women, I think that a lot of our libido is tied to body image stuff, right? And so when you're in the postpartum period and you're like, my body's just not the same anymore, or as we enter menopause and, you know, our bodies are changing, we don't have as much muscle mass, we're having more abdominal obesity, you know, all of these changes that make us just not feel comfortable in our own skin and less sexy. Of course, like losing weight and feeling better, like, yeah, probably will boost your libido.
Yeah. In terms of the research piece of it and libido, and I have looked, I mean, your website's a huge resource, but part of the problem is I feel like women aren't sure when their libido's low, because how do you figure out what baseline is?
That's a great question.
Right? And also, you know, is there some supposed to be time that you are supposed to want to have sex? We don't know.
Right.
And it's only in comparison, at least in a cis hetero relationship, where all you have to compare is your partner or several partners, whatever it might be, and their desire might be totally different than yours. So how do you figure that out?
Yeah, that's a great question. And I think that there is no perfect answer for this. There isn't like, this is what your baseline libido should be, and that if you're above that, you're more. And, you know, like, there is no perfect, that it's all a range and a spectrum. I think that for most patients that I talk to, we talk about the mismatch between you and your partner. Because if you're, you know, let's say you're both in a time in your life where sex is just a little bit less important, and you have young kids and you're doing your thing and you're super busy, and like, he's not asking for sex a ton, you're not interested in sex a ton, that in and of itself isn't a problem, right?
You're both okay with it.
Exactly.
It's
as
working.
long as you're both okay with it and it's working, that's okay, right? It's when there's this mismatch that's, I feel like, generally when people are coming to my office being like, I have low libido, right? Because then they have a partner that's wanting sex more than they're willing to give it.
Okay. That's like a good baseline to look at. How do you feel about birth control pill?
In terms of birth control pills, I guess a couple ways that can impact libido. For some people, the idea of an unwanted pregnancy, or like that this is sort of a risky thing that we're doing, that can dampen libido. And so then for them, being on birth control and knowing that they feel confident, like, I'm not going to get pregnant unless I want to. For some people, that can actually really boost libido and be helpful. Most of the time, I think we think about birth control as a dampener of libido. And I've had many, many patients come in who are, say, I've been on birth control pills for years, and I have just now realized maybe before I started the pill, I had a better sex drive. Like, could that be what it is? And certainly that's the case. I mean, there's plenty of birth control pills. There's one specifically that have more of what's called a sex globulin binding hormone. So that is like decreasing the sex hormones. And so for a birth control pill like that is notoriously going to have a little bit more of an impact potentially on your sex drive. And not necessarily that it's the same for everybody, right? Like, so there's some people who could be on, so Yaz, for example, is a common birth control pill that is known to do this.
Or should I say yes? Sorry, I had to.
Thank you for that. That's good. But so that is, one that is sort of quote unquote notorious for bringing down some of our sex hormones. And that's part of the reason that it works really well for acne. It's part of the reason that it can be really good for moods, like people who are having mood changes with hormonal birth control, but it also can dampen our sex drive. So when a patient comes into me and they're on birth control pills, and that's part of the piece of us, figuring out this puzzle of like, what can we do to improve their libido? That is something that we'll look at of, do we want to not necessarily stop birth control, especially if they're on it because they don't want to get pregnant. But are there other ways that we can explore? Is there a different pill we could put you on? Is there a different formulation, etc.?
What led me to that question was long-term effects. And I think we're finally now starting to see some of the longer-term effects of birth control. I talk about this all the time with my infertility people because they're all terrified, as I was when I was going through it, that I took the pill for too long and it reversed my ability to have children. Is that a myth?
I mean, as far as the data that I have looked at, absolutely it is a myth.
Yay.
Without question.
Okay, good.
I mean, of course, and you all know this because we are living in the world that we are, any study can show you whatever they kind of want.
And you can find it all on Reddit or Google 100%. To find that, to bolster either side of what you want it to bolster.
Correct. But in terms of the good data that I have evaluated myself, no, there is absolutely no study that has shown that to be the case.
Okay, good.
In terms of birth control pills, and specifically, and this is what I usually quote my patients, there is some data that the first 3 months that you're off the birth control pill, that your fertility may be slightly dampened, because it does take a bit for those hormones to kind of get out of your system. For the depot shot, which is an injectable, that actually can decrease fertility for about a year.
Oh, wow. Meaning you need to be off it a year before you start trying, ideally?
Not that you have to be on it before you start to
be off it before
you start trying, but that it does have the potential to decrease your fertility for
so
that
if
long.
things aren't happening right away, that might be one of the
100%.
reasons why. Okay.
And it's also why, and not very many people use Depo these days, but for my patients who were thinking, in the next couple of years, I'm maybe going to want to be thinking about fertility, that would be something I would steer them away from for that reason. A lot of the, long-term reversible contraception, like an IUD, for example, the part of the thing that I love about IUDs is they are completely reversible. The second they are removed, your fertility is completely restored. So, it's variable in terms of birth control. But to answer your original question, birth control is safe.
Great.
You can be on birth control pills. It will not decrease your long-term fertility.
And speaking of which, I saw one study last night that as I am openly on HRT and the estrogen patch, that if you started in perimenopause, there was some insanely high number of decrease in dementia and heart disease, which made me so happy. Yeah, and it's so generational. Like when I went on my hormone patch, both my mother and my stepmother were like, is that safe? Because they're still of that generation that had that one study in 2002 that ruined everything for so many people for so long. Right. And for them, I'm like, I wish they would have gotten on it at the right time,
Absolutely. Yeah.
It's
and
crazy.
that, I think that with most things in medicine and in life, it's a pendulum,
of
right?
Course.
And right now we are swinging very much towards the hormones are wonderful and let's be on hormones.
Totally. Let's keep it that way for a while.
Absolutely.
Don't get me wrong.
I'm very pro this.
Yes. It's just interesting.
It is interesting. Yeah, it is interesting.
What do you do to take care of you?
Oh, that's a good question.
Do you do enough to take care of you?
I have, of course, a busy life as most of us do, with a full-time job and 2 young kids. And I think I do actually right now at least feel like I'm in a good place with it. I exercise regularly.
What's your favorite exercise? Form of exercise?
That's a good question.
I don't even have one single favorite. I hate them all.
You hate them all?
Yes, I do. I like walking or watching other people exercise, but that's
watching other people.
That's about it.
Awesome.
I hate them all. Yeah.
For me, it's probably running, just because that's always been my go-to. Yeah. And it's so easy. You can do it wherever you are. It's such a good release for me, and it's such a good, just like clear my head.
Yeah.
Most people, will run with like a podcast or music. I run silent.
Wow. That's really good.
Yeah.
I envy that.
Yeah,
honestly.
It's lovely.
I was just talking about that with my husband. Like, we constantly have something playing in our ear. Doing dishes, I'm listening to something. I'm like, when is the quiet time? We have to make it.
Exactly.
Thank you for that reminder.
Yeah,
I always like to ask, is there any other like wellness trend that you have adopted? Like some people say, the cold plunge or a red light sauna. Is there anything out there that's considered wacky that you might love?
That's a good question. Not really. Nothing that's like super wacky.
By the way, cold plunge and red light are not wacky. It's just like those are more trendy, I should say.
Yeah, absolutely. Yeah. Absolutely. The thing that I think that is for me has become just a really excellent addition to my wellness practice is a lot more yoga, and just feeling, the centering of that. I feel like when I was a younger woman in my 20s, I thought yoga was so boring and like not a good workout.
Yeah.
Yes. Like, this is so boring. Yes. And I'm not even getting sweaty.
Right. Right. But now
Exactly.
Yes.
Right. And
that is one I will put on my list as like will do sometimes.
Yeah.
But
exactly.
I think that one, much like anything you do at the gym, you don't want to do it, but after you feel so good.
You feel so
with
good.
yoga especially, you're like unpretzeled.
Yeah.
Exactly. Is there any last words in terms of like any advice you were given or that you like to give that keeps you going?
Oh, that keeps me
Could be
going.
like from your mom, a grandma, something maybe you tell your kids. It could be a phrase, a cliche.
So one of my most favorite things, and this actually comes from Sarah Toogood, my partner, so shout out to her.
Okay. Second shout out, just saying. Good. I got to meet this lady.
She's like my work wife. She's really lovely.
Yeah.
Having a work wife, I highly recommend. My husband is fabulous too, but
of course.
my work
Good
wife,
work wife is, I get
that. So one of her favorite mantras, and it's so simple, is one thing at a time.
So good.
It's so good, because whenever I'm feeling overwhelmed, same thing with my kids, one thing at a time.
That's right.
And I guess of a similar note, my mom would always tell me, make a list. whenever I was feeling,
we're big listers in my home as well.
Oh, I love a checklist.
Yeah. When we moved my grandmother out of her home, there were notebooks everywhere with like lists. And my daughter, I swear, the minute she could start writing, was like, I'm going to make a list of. And I really think it is generational. Yeah. And I do think it's a way of coping with anxiety that I think is phenomenal.
Agreed. Yeah.
I'm so glad I got to have you here.
Yes, my
Thank
pleasure.
you.
Absolutely. This was
we
really
will
fun.
link all your things and give you all the shout outs.
And
thank you for being so open about libido.
Of course. My pleasure.
Okay.
Thanks for having me. Bye.